Physicians, what's the worst injury you've seen at a routine checkup? Story 1. I'm the moron patient. I had fallen through a ceiling 3 years prior and had just worn a knee brace. My employer required me to go to the company doc for a yearly physical. I'm not a doc, so I can't gauge, but here's the list that came out of that visit. Torn meniscus, ACL, rheumatoid arthritis, Hashimoto's disease, and the place I went had in-house genetic testing, and the doc suggested that I should get tested, since I had Hashimoto's and rheumatoid, to help determine what else I had. It was out of pocket, but I thought, why not? I'm sure it was one of those upsell sort of deals, but it really paid off in my case. Test found all kinds of crazy crap that I carried, but don't have as of now, most of it autoimmune related, but found Thompson's disease, which is what those fainting goats have that cause them to faint. In reality, my understanding is that they don't faint, their muscles involuntarily lock up and they just physically can't get up. I have a mild case of it that only affects my arms, but it's estimated that like 1 in a million have the mutation. I have to wear a brace on my arms from time to time if I have to make a very quick movement. I'd had a lot of unexplained muscle soreness that suddenly made sense. Another weird side effect I have is that I have trouble swallowing food from time to time, and if I go all a day without eating, it's almost impossible to hold my eyes open by the evening, and it has nothing to do whether I'm sleepy or not. He's my primary care now, amazingly thorough. My God, I wish I had your doctor. Story 2. Mine's nothing on the few things that are here, but I can share something I found myself. I'm an ophthalmic technician. Basically, my job is to do the diagnostic scans and workups on patients before the eye surgeon sees them for routine consultations. One day, a lady came in, referred from her optometrist for cataract surgery. The optometrist did note that she had slightly higher than normal pressure in one eye at 23, normal ranging typically between 10 and 20. When I checked her pressure, it had risen to 35. Normally, straight after this, I would dilate her eyes so the doctor can see inside, but I told the lady that based on a hunch, I wanted to do a scan of the angles between her iris and cornea before doing that. I found that these angles had closed. Basically, due to her growing cataract, her iris had pushed out, blocking the gap at the outer edge of her iris where the fluid in the eye generally flows. Because of this, the fluid in her eye was very quickly rising. Acute angle closure glaucoma isn't rare, but if you dilate someone's eye who has it, you close those angles even more and eye pressure continues to rise rapidly, causing death of nerves in the eye. I'm just the tech, but thanks to my hunch and scanning first, I could have saved her sight. The doctor performed laser treatment that day to hold those angles open until her cataracts can be removed. Diligence. More people need it. Good save. Story 3. Junior doctor from Australia. I had a young lady come in for a pap smear. She was chatty and relaxed, not nervous at all. She lay on the bed and I got the speculum ready. I opened it up and instead of seeing her cervix, I saw a kiwi fruit-sized blob of bloody tissue just hanging out in her vaginal canal. It was one of my first pap smears I ever did, and I had a sudden bizarre thought that I had broken her vagina. I hadn't thought it was just a big uterine polyp that had emerged and was in her vagina, hanging by a thread of tissue. She was mortified, although I tried to reassure her. This was in a small town, and later that day, I went to the bakery to get some lunch, and she was behind the counter. The most common surprise I see is patients in long-term marriages who come up positive for chlamydia. From Australia, kiwi fruit-sized blob of bloody tissue? Yep, checks out, bloody kiwis. Story 4. Not a physician, but did EMT work while deployed for local nationals seeking help. Had one guy get carried in from the nearby village, and we were called out to the ECP to see what we can do. For a toothache. He's barely responding when we arrive and smells worse than death. Still makes me gag thinking about it. Start doing the usual initial contact assessment, and he's in bad shape. Vitals are all low, he's hardly there, and pus keeps oozing from his eyes and other orifices whenever you touch or apply any pressure to his face, which feels like an old soggy banana. Come to find out, he's had an infection for like 10 years, and it's spread throughout his skull, neck, and into his chest. A single tooth. Long story short, he passed away not too long after that while we were waiting for transport. The dude went down because he didn't take care of an infection. Never seen anything like that, and doubt I will again. Story 5. This was not a routine medical exam, but I was a triage nurse in the ER when a patient calmly walked up and reported a complaint of pain in my side. He failed to mention the blood and the handle of the butcher knife sticking out of the left lower quadrant of his abdomen. He was a homeless schizophrenic who had been stabbed and had calmly walked into the ER and waited his turn to be seen. I'm just glad he came in at all. We also get a lot of people who come in for other things, a sore throat or a cough, and when doing a skin assessment, we find huge pressure ulcers or gangrenous feet. I have twice had patients' toes come off when I removed their socks. Neither time had they come to the ER for that issue. Story 6. I was working at Target, lived half a mile away, so I walked to work. It totally sucked, but I was out of shape and had cold-induced asthma, so I ignored it. At this time, I was picking up shifts left and right, so sometimes I was closing the coffee shop, sometimes coming in at 4 a.m. to unload the truck. I was basically a zombie from what I assume was lack of sleep. This goes on for a couple months until I had my annual physical. I was joking with my doctor that I was super exhausted from work and I must be getting out of shape because that half-mile walk to work really sucks. Turns out I had severe pneumonia. One lung was totally full of liquid, and the other had some liquid too. The doctor couldn't believe I was still up and about, let alone walking to work and whatnot. Story 7. My brother once jumped on the front of my white car, grabbing the front pillars with his hands. I closed the door and caught his finger, which he pulled out quickly, as you do, but there was a tiny chip of paint that had come off the car and got lodged under the skin somehow. He must have spent a week or so chewing on it to try to get the paint out, but it just wasn't working. So he went to the doctor to see if he could help. After checking it out, the doctor tells him, the reason you can't get that out is because it's your bone. Apparently, when I shut the door on his finger, I'd broken the tip of his pinky enough so he could see the bone through the skin, and he'd spent the next few days trying to pull his own finger bone out with his teeth. Well, this was the one that made me put the phone down and just stare off into the distance. Story 8. A patient who had a routine checkup at his ophthalmologist, eye doctor, who found a small spot in his retina, was referred to a university hospital. Tests showed it was metastasis from a small malignant melanoma he had on his back. Our professor canceled our lecture because he had to tell this otherwise healthy man that he probably only had a couple of months left to live. One of my parents' oldest friends had a similar story, went for their annual eye test. Optician suspected it was a detached retina and sent them straight to the hospital. Turned out it was retinal cancer. Almost 7 years later, and fingers crossed, all is well now. Story 9. Guy comes in for an eye exam. I note one eye seems a bit redder than the other. He tells me it's been like that since a branch snapped back and hit him in the face 3 months earlier. I look under his upper eyelid, and there's a piece of wood the size of a Tic Tac embedded in the underside of the eyelid. Cannot believe it did not bother him more. One time my eye was kind of bugging me for a few days. I was rubbing it and looking at it in the mirror when I noticed a tiny little hair in the corner of my eye. I got it with a tweezer and slowly pulled out an 8-inch long hair from my eye socket. It went way back too, and felt totally bizarre coming out. It was also coated in eye goo. I have no idea how it got in there. Eyes are weird. Story 10. Pre-registration optometrist here. Had a lady present recently for an eye test following months of very painful headaches. She had scans done at the hospital recently, and everything had come back normal. The only reason she was in for a test was that her eyes were the last thing she could think were causing it, and she was due for a checkup anyway. Cue me looking into her eyes and finding her optic nerves in both eyes, which usually lie flat against the back of the eye, swollen and pressing forward, with massive hemorrhages in the nerve fiber layer of her retina. Naturally, the hospital was phoned and she was seen within the hour. The swelling had been caused by raised pressure in her head, a potentially life-threatening condition. As far as I'm aware, the neurologists are now on top of it, and she's recovering well. Scary stuff, as I had only been qualified 2 months at the time. Story 11. Not me, but a friend of mine who worked in the ICU, and he once told me about a girl who came in who was on a jet ski, and her bikini bottoms got caught on something and ripped her entire bottom open. Vagina to butthole, completely ripped open. He said that stitching her up was incredibly awkward, because she was a little drugged and super flirty. I am always wary of loose item ends that can be snagged somewhere, like a scarf when go-karting, etc. But I thought that a bikini was tight enough to be safe. A girl in Turkey was decapitated while go-karting because her scarf got caught in the rear axle while she was driving at speed. Yes, there's an aftermath video on the internet. No, don't look it up. Story 12. I'm a nurse, but some guy came in with Lefort 2 and 3 fractures. Said that he fell and hit his head on a tractor step about a week ago. Was just coming for medication refills when we asked about the mild facial trauma. Tiny laceration, unremarkable bruising. Denied all pain medication and very minimally accepted it after surgery only because we practically talked him into it. Maxillofacial surgeon was excited about it. She came down personally to get him and take him up to surgery. I love when surgeons get excited about things. Story 13. I was putting a patient with mild breathing difficulty on a COPD research study. He remarked that he had been healthy as a horse all his life. The next day, his routine chest x-ray showed metastatic lung cancer. He didn't make it more than 2 months. My best friend of 24 years went to his doctor complaining of heartburn. They gave him medicine, went back a month later with different medicine, went back another month later, still not cured. They scoped his stomach, stage 4 stomach cancer, and he was healthy and athletic. He passed away 2 weeks ago after 18 months of fighting it. Story 14. Not a routine checkup. A woman 36 weeks pregnant comes into the doc in the box complaining of nausea, vomiting, and pain between her shoulders. We ultrasound her abdomen. Everything was fine with the kid. Somebody had the bright idea, as long as the ultrasound was out, to ultrasound between her shoulders. To our astonishment, she had a huge dissecting aortic aneurysm. She had to be survival flighted to a level 3 place and have a crash C-section and her aneurysm fixed. The aneurysm was at least 5 centimeters across. She and the baby both made it. Story 15. First-year nursing student in LA, and I was at clinicals when a guy who I had to do a physical assessment on, all we could do since we don't know much, tells me he's been hearing strange cracklings and noises in his ear. I check his ear, and it is filled with so much wax and whatnot. Call my RN advisor, and she proceeds to clean out the guy's ear. What does she find? Freaking fruit fly nest. Yeah, the medical field can get pretty rad. It's always insects. It's never a puppy. Story 16. Not a physician, but I was doing medical service in Guatemala, and we had an older gentleman come into our clinic to have a checkup. And the entire time he sat there with us, he was resting his arm on what we thought was a bag or purse on top of his leg. At one point, he goes to move, and we see a huge lump underneath his poncho, what we thought was his bag, and ask him about it. Turns out it was a tumor that had been growing for about 10 years on his leg, and he wasn't even going to tell us about it. Story 17. I went to urgent care, and someone must have miscommunicated with the doc, because I rolled into a room in a wheelchair, and doc asked me about my cold. I said I don't have a cold, but I'm not sure what I did to my leg, and rolled up my pants. My kneecap was on the side of my leg. They seemed rather surprised. They told me to go to the ER immediately. Slightly confused by how someone mixed those two things up. Story 18. Went to go see my doctor for a checkup, had chest pains waking up that morning, started to feel like someone is sitting on my chest. Walked 15 minutes to the physician's place, and apparently after he checked my breathing, he told me I had to go to the ER to get my lungs x-rayed. Spent a week in the hospital for having a 40% collapsed lung. Doctors called it a spontaneous lung collapse. Really not the kind of spontaneity I'm looking for in my life. Spontaneous pneumothorax. Incredibly painful. I had one at 25 while brushing my hair. Story 19. Heard this story from my aunt who works in an eye center. One day, this woman came in with her friends, all drunk and high as frick as crap. She was holding her eyeball. Somehow, she had popped it out of its socket. The kicker is, after surgery and all that, she still seemed cheerful and even asked my aunt when her eyesight would recover. Apparently, she was under the impression that her eyeball could be reattached and managed to get hit in the face by a pair of heels, and it pulled out her eyeball in the process. Story 20. ED doc, so hardly a routine visit, but a guy comes up to the triage window with his arms over his head, palms of his hands pressed against his ears. I'm in tremendous pain, he says when asked what's wrong. X-rayed him and found he'd broken his neck. He'd been walking around with it for 3 days. Story 21. Not a physician, but X-ray tech, had a patient walk into the urgent care for hip X-rays. Her order said it was for hip pain, which is pretty routine. Turns out she had walked in on not one, but 2 fractured hips. Cannot even freaking imagine how painful that must have been. Story 22. A guy comes into work with half of his face just sort of sagging. They were working 6 days a week, 10-hour days at this point, so he just thought he was tired. He went to the doc. Turns out he had a massive stroke and was unalive within the week. Story 23. Guy shows up for a discharge physical, Marine, noticed what looked like cellulitis on his leg. Turns out it was a brown recluse bite that he ignored. Had a fist-sized hole of dead tissue in his leg. We treated it with maggots for a few days. It healed over with a very nasty dent and a scar. Story 24. My mom's a nurse and told me about the time a bodybuilder came in with a pulled muscle somewhere in his abdomen that was causing him severe pain. Long story short, the guy was riddled with cancer. It was everywhere. Apparently, he was dead within 72 hours. Story 25. We just got a guy in with Fournier's gangrene from a very alarmed family practice doc. His nuts are in his thigh now. I am warning everyone, don't freaking look it up. Story 26. Yeah, man, make me want to get a full body exam. I've read some crap. I'm with you. Reading these makes me think there could be a billion things I have that could kill me. Please leave your stories in the comments. I'd love to make a video of them in the future. Also, don't forget to like and subscribe.